First, observe the posture of the client. Then observe the gait and also the arm swing. Then the foot position. Inspect and palpate the TMJ. Then ask the client to move the jaw from side to side. Then protrude and retract jaw. Test ROM. Ask the client to open the mouth and move the jaw laterally against resistance. With the client sitting, inspect the sternoclavicular joint. Then observe the cervical, thoracic, and lumbar curves from the side, then from behind. Palpate the spinous processes and the paravertebral muscles on both sides of the spine for tenderness or pain. Then test ROM of the cervical spine. Then test the lateral bending of the client. Evaluate rotation. Ask the client to turn the head to the right and left. Test ROM of the lumbar spine. Ask the client to bend forward and touch the toes. And ask the client to bend sideways or lateral bending. Test for back and leg pain. Then measure the leg length of the client. Inspect and palpate shoulders and arms. Test ROM. Ask the client to stand with both arms straight down at the sides. Then have the client bring both hands together overhead, elbows straight, followed by moving both hands in front of the body. In a continuous motion, have the client bring the hands together behind the head with elbows flexed. In elbows, inspect for size, shape, deformities, redness, or swelling. Test ROM. Flex the elbow and bring the hand to the forehead. Then hold arm out, turn the palm down, then turn the palm up. For wrist, inspect for size, shape, symmetry, color, and swelling. Then perform the squeeze test by squeezing the client's hand across the knuckle joints as shown. Palpate the anatomic snuff box. Test ROM. Ask the client to bend the wrist down and back. Next, have the client hold the wrist straight and move hand outward and inward. Test for carpal tunnel syndrome. Then perform Palan test and Tinel test. Observe for the flick signal. Then test for thumb weakness. Ask the client to raise thumb up from the plane of the palm. For hands and fingers, inspect size, shape, symmetry, swelling, and color. Test ROM. Ask the client to spread the fingers apart. Make a fist. Move the thumb away from other fingers. And then touch the thumb to the base of the small fingers. With the client standing, inspect symmetry and shape of the hips. Test ROM. With the client supine, ask the client to raise extended leg. Flex knee up to chest while keeping other leg extended. Move extended leg away from midline of body as far as possible and then toward midline of body as far as possible. Bend knee and turn leg inward and then outward. Ask the client to lie prone and lift extended leg off table. For knees, inspect the size, shape, symmetry, swelling, deformities, and alignment. Palpate for tenderness, warmth, consistency, and nodules. Perform the bulge test if swelling is present. Then press on the lateral side of the knee and look for a bulge on the medial side of the knee. Then perform the ballottement test. Test ROM. Ask the client to bend each knee up toward buttocks or back. Test for pain and injury. For ankles and feet, inspect position, alignment, shape, and skin. And palpate ankles and feet for tenderness, heat, swelling, or nodules. Then perform the squeeze test by squeezing the middle of the foot with your hand across top of foot as shown. Test ROM. Ask the client to point toes upward and then downward. Turn soles outward and then inward. And lastly, rotate foot outward and then inward.